COVID-19 vaccination information. In this presentation, we will cover how COVID-19 vaccines work, vaccine efficacy and safety, the benefits of vaccinations, the risks of not being vaccinated, and possible side effects of vaccination. How COVID-19 vaccines work. The mRNA vaccine, either Pfizer or Moderna, is based on SARS-CoV-2 genetic code, or RNA. When a person is injected with a vaccine, the RNA enters the cells, telling them to produce some of the coronavirus proteins, allowing the immune system a preview of what the virus looks like. This causes the immune system to produce antibodies from B cells and to activate T cells, making them ready to destroy infected cells if a later infection occurs. B and T cells work together to develop antibodies and even kill cells should they ever be infected by the virus. If a person gets exposed to SARS-CoV-2, these antibodies and T cells are automatically triggered to fight off the virus. The immune system begins responding to the vaccine immediately, often presenting as mild symptoms, but it takes roughly 2 weeks to reach a maximal response to each dose of the vaccine. For more information on how do COVID-19 mRNA vaccines work, please visit the Government of Canada website where they list a YouTube video on the topic. Vaccine efficacy and safety. mRNA vaccines, Pfizer and Moderna, have been demonstrated to be both safe and highly effective in clinical trial and real-world data of unprecedented level and scrutiny. While a single dose offers some protection by priming the immune system to develop an effective and longer-lasting, high-quality protection against SARS-CoV-2 and its emergent variants, it is recommended to get 2 doses of either vaccine. As we learn more about vaccine effectiveness against emerging variants of concern and how well our immune system retains vaccine-induced memory of the virus over time, additional recommendations may follow. Mixing vaccines. According to the National Advisory Committee on Immunization, vaccines can be safely mixed for a first and second dose. According to the Ministry of Health Ontario, receiving a mixture of approved vaccines is at least as effective as getting 2 doses of the same vaccine. The benefits of getting the COVID-19 vaccine. Vaccination is one of the most effective ways to protect our families, communities, and ourselves against COVID-19. Evidence indicates that vaccines are very effective at preventing severe illness, hospitalization, and death from COVID-19, including against Alpha and Delta variants of concern. It reduces the risk of spreading COVID-19 to others. It increases community protection, making it harder for disease to spread, contributing to herd immunity. It helps prevent the COVID-19 virus from spreading, replicating, and mutating. If you require additional information, please visit the Province of Ontario YouTube video on the topic. The risks of not being vaccinated. Waiting to be vaccinated allows the coronavirus to continue spreading in the community, with new variants emerging. Severe illness, hospitalization, and death can result from exposure to the COVID-19 virus. The sooner you get vaccinated, the sooner you are protected. Possible side effects of vaccination. Like any medication, vaccines can cause mild side effects and reactions. These can last a few hours or a couple of days after vaccination. Common side effects include redness, soreness, or swelling on the arm where you received the shot, tiredness, headache, muscle and joint pain, chills, and mild fever. The vaccines cannot cause COVID-19. This is because they do not contain the SARS-CoV-2 virus responsible for the disease. However, if you come in contact with the virus just before or after you complete the vaccine series of 2 doses, you could still develop COVID-19. If you require additional information, please visit the Province of Ontario YouTube video on the topic.